Hello, my name is Malaysia Kennedy, and I'm here to inform you about PCOS. What is PCOS? Polycystic ovary syndrome. POS is a hormonal disorder commonly among women of the reproductive age. This is to inform you the many ways POS is publicized on how women can cope. I myself suffer from PCOS. When I was 15 to 16 years old, I started seeing facial hair and didn't know where it came from. I didn't know by the age of 21, I finally was diagnosed with PCOS. I went years not knowing about this syndrome. The point is to inform you and the audience to understand how women deal with PCOS and how it's difficulty for women to deal with it, with having pregnancy and also with diabetes being a main cause of it as well. Doctors actually don't know what is the main cause of PCOS. Some women possess facial hair, they might possess excess body hair, or they say that 1 in 10 women have this syndrome. Some women have diabetes and they are actually insulin resistant. Most women with PCOS do have diabetes, as stated, and that is the main cause of some of the PCOS. So once you get your diabetes in control, the PCOS will slowly slow down the process of the hormonal growth. And sometimes you may have a cyst on your ovaries or you have the facial hair. Now, I know a lot of women now, they don't have facial hair, but they do have the cyst on their ovaries. And sometimes they have to get surgery for that. So at this point, you would say you would rather have the facial hair a little bit more than the cyst on your ovaries. I don't have any cysts on my ovaries. I have the facial hair and excess body hair. There are 4 types of PCOS: insulin resistant, inflammatory, hidden cause, and pill reduced PCOS. Pregnancy is very limited with PCOS. Some women have to get IVF completed, and it's also a hard time to conceive. Some even have to try to conceive with drugs. Not like bad drugs, but with medicine and everything like that. Is there a cure? No. Being overweight and obese can help. We need to help ourselves by losing the weight and everything like that. That brings down the PCOS and the causes and the abscess and everything like that. But it also is hard to lose weight as well with PCOS, unfortunately. So there's not much treatment available for women. Sometimes we have to use birth control. That brings down your cycle. Sometimes birth control isn't the best. It doesn't work all the time. I've used it a couple times and it actually brought it down and it keeps it going. Women under 35 tend to get this syndrome. If women get fertility treatments, it's likely chances they may have a baby. PCS does not go away. Also, food choices is important as well. Whole grains, veggies, and proteins, we need to take those. No processed food dealing with PCOS. Exercising is very important as well. Cycling, swimming, it can help get the weight off a little bit quicker. And also, exercising helps your insulin resilience. PCOS is an important aspect of women if they have it. It changes the woman and makes her unlikely to conceive the natural way. Again, sometimes we have to get IVF or we have to use birth control to bring it down. It just depends. But once taking proper care of the syndrome, it becomes less harmful. Although it is hard to lose weight in other aspects, but if we put those in place, we'll be okay. Unfortunately, all women cannot have natural births with PCOS. Sometimes the babies are formed in the fallopian tubes or just anywhere besides where they're supposed to be formed at to conceive. So unfortunately, it is hard in some of those aspects and women have to be very, very careful. I know my doctor told me it's going to be hard. You're going to have to come to a lot of appointments. You're going to have to do a lot of things in order for you to know that this baby is going to be properly, properly have a birth, a great birth. So some of my reference are Women's Health, Web, MD, the Healthline, the Mayo Clinic as well. So if you want to check those out and just put PCOS and they'll tell you everything. Thank you for listening.